You've probably heard the buzz about okra. This humble green pod, often called lady's fingers, is hailed as a superfood packed with benefits for your heart, digestion, and blood sugar. But before you toss it into every stew or smoothie, there's something most people overlook: the hidden side effects of okra that can actually backfire if you're not careful. In this video, we'll explore the science-backed reasons why okra might not always be your friend, especially when it comes to medication interference, digestion, and kidney health. Let's dive into the 7 most important side effects every health-conscious person should know, starting with a big one that affects millions of people worldwide. But before we dive into all that, if you're new here, welcome to the channel. We're here to help you live healthier, feel better, and age vibrantly. Be sure to like this video, subscribe, and turn on the notification bell so you never miss a wellness tip that could change your life. And tell us in the comments, where are you watching from? We love hearing from viewers around the world. Side effect number 7: gastrointestinal inflammation in sensitive individuals. While okra is widely celebrated for its anti-inflammatory and gut-supportive properties, it can have the opposite effect in certain individuals, especially those with underlying digestive disorders. Contrary to its soothing mucilage and fiber-rich reputation, some people may experience gastrointestinal irritation or inflammation after consuming okra. For instance, individuals with irritable bowel syndrome, IBS, might find that okra worsens their symptoms. Although okra contains non-fermentable fiber, which typically reduces gas formation, individual responses to fiber types vary significantly. In some IBS sufferers, the mucilage, a sticky gel-like substance found in okra, may lead to bloating, cramping, and unpredictable bowel movements. Moreover, for people with inflammatory bowel diseases, IBD, such as Crohn's disease or ulcerative colitis, okra's slippery texture and fibrous content may aggravate the already inflamed digestive tract. The mucilage, while beneficial to a healthy gut lining, may act as a mechanical irritant when intestinal walls are inflamed, potentially intensifying pain or triggering flare-ups. Similarly, individuals with gastritis or peptic ulcers, conditions marked by inflammation or erosion of the stomach lining, might also find okra uncomfortable. Although it's believed to coat and protect the stomach lining, when prepared with acidic ingredients like tomatoes or hot spices, it may exacerbate symptoms such as burning, nausea, or discomfort. Additionally, the high fiber content, about 3 grams per 100 grams of raw okra, can be too much for those with compromised digestion. Excess fiber may lead to gas, bloating, or diarrhea if the digestive system is already sensitive or inflamed. Side effect number 6: nutrient absorption interference. One lesser-known drawback of okra is its potential to interfere with the absorption of essential nutrients and certain medications. This is largely due to its high soluble fiber and mucilage content. Here's how. Soluble fiber can bind to minerals like calcium, iron, and zinc in the digestive tract, forming complexes that the body cannot absorb efficiently. Over time, if okra is consumed in large quantities without dietary variety, this may contribute to micronutrient deficiencies, especially in individuals with already marginal nutrient intakes. The mucilage may slow gastric emptying and interfere with the absorption of oral medications. This could diminish the effectiveness of drugs that require rapid uptake, such as certain antibiotics, thyroid hormones, and cardiovascular drugs like warfarin or digoxin. Okra also contains lectin-blocking compounds. While this can help reduce the effects of harmful lectins from processed or inflammatory foods, it may unintentionally interfere with the digestion of beneficial plant proteins and phytonutrients when consumed in the same meal. A study published in Pharmacognosy Review suggests that high-fiber and mucilaginous foods can alter the pharmacokinetics of certain medications, delaying their onset of action or reducing bioavailability. For individuals on medication, it's advisable to space okra-containing meals 2 hours apart from drug intake to minimize this interaction. Side effect number 5: allergic reactions and skin irritation. Although relatively uncommon, allergic reactions to okra can be serious. Okra belongs to the Malvaceae family, which includes plants like hibiscus and cotton. Individuals with known sensitivities to this plant family may experience allergic responses ranging from mild to severe. Common symptoms of a food allergy include skin reactions, rashes, hives, itching, swelling of the lips, tongue, or throat. Gastrointestinal symptoms: nausea, vomiting, abdominal cramps, or diarrhea. Respiratory symptoms: wheezing, nasal congestion, or difficulty breathing. In rare but severe cases, okra can trigger anaphylaxis, a rapid-onset allergic reaction that requires immediate emergency treatment. Symptoms include a sudden drop in blood pressure, difficulty breathing, rapid pulse, and loss of consciousness. Additionally, the mucilage in raw okra, the thick, gelatinous substance, can cause contact dermatitis in sensitive individuals, particularly in those who handle it often, like chefs or home gardeners. Wearing gloves while handling okra and washing thoroughly after contact can help minimize this risk. Side effect number 4: blood pressure fluctuations, a double-edged sword. Okra is often praised for its cardiovascular benefits due to its rich antioxidant content, high fiber levels, and magnesium, all of which play important roles in heart health. Magnesium, in particular, acts as a natural vasodilator by relaxing the blood vessels and improving blood flow, which can effectively help in lowering high blood pressure. According to the National Institutes of Health, dietary magnesium intake is inversely associated with the risk of hypertension. However, for individuals already on antihypertensive medications, consuming okra in large amounts can lead to hypotension, dangerously low blood pressure. When combined with drugs like ACE inhibitors, beta blockers, or diuretics, okra's natural pressure-lowering effect can become too potent. This can result in symptoms such as dizziness, lightheadedness, fatigue, blurred vision, and fainting, especially in elderly individuals or those with pre-existing low blood pressure. Moreover, okra is a potassium-rich vegetable. While potassium is essential for proper heart rhythm and muscle function, those with chronic kidney disease, CKD, must limit potassium intake. Impaired kidneys may not filter excess potassium efficiently, leading to hyperkalemia, which can cause dangerous arrhythmias and even cardiac arrest. Therefore, anyone with cardiovascular conditions or kidney issues should consult a healthcare provider before significantly increasing their okra intake. Side effect number 3: kidney stone formation, the oxalate problem. While okra provides essential minerals like magnesium and calcium, it also contains a hidden danger for those prone to kidney stones: oxalates. Oxalates are natural compounds that bind with calcium in the kidneys to form calcium oxalate crystals, the most common type of kidney stones. Individuals with a history of kidney stones or those genetically predisposed should limit their intake of high oxalate foods like okra. Signs of developing kidney stones include sharp pain in the lower back or abdomen, nausea and vomiting, painful urination, pink or reddish urine, a sign of blood. According to the American Urological Association, dietary oxalates can significantly increase the risk of recurrent kidney stones. Okra has been classified as a high oxalate vegetable, especially when consumed cooked or in concentrated forms like okra water. Side effect number 2: digestive disruption, when fiber becomes your enemy. Okra is rich in soluble fiber, specifically pectin and mucilage, which helps slow digestion and improve satiety. But in people with sensitive guts or those unaccustomed to high-fiber diets, this can wreak havoc on digestion. Too much okra can cause bloating and flatulence due to fermentation of mucilage by gut bacteria, abdominal cramping, diarrhea in some cases, worsening of symptoms in people with IBS or SIBO, small intestinal bacterial overgrowth. While soluble fiber is often considered beneficial for gut health, it also acts as a prebiotic, feeding gut bacteria. A sudden influx can lead to an imbalance in the gut microbiota, producing excess hydrogen and methane gases, especially in individuals with dysbiosis. Introduce okra slowly into your diet and drink plenty of water to help fiber move through the digestive tract. Side effect number 1: medication interference, the blood sugar trap. Okra is celebrated for its ability to help regulate blood glucose, but if you're already on diabetes medications like metformin, it may actually do too much. That's because okra contains polysaccharides and flavonoids that mimic insulin's effects. These compounds help slow the absorption of carbohydrates and reduce glucose spikes by inhibiting alpha-glucosidase, an enzyme involved in carbohydrate digestion. This insulin-like effect, while beneficial on its own, can become dangerous when combined with glucose-lowering drugs. The synergistic effect can lead to hypoglycemia, dangerously low blood sugar, which can cause dizziness, weakness or confusion, excessive sweating, heart palpitations, fainting, or even seizures in severe cases. A 2011 study in the Journal of Pharmacy and Bioallied Sciences found that aqueous extracts of okra significantly reduced blood glucose in diabetic rats, even without medication. This reinforces the need for close monitoring and medical consultation if you're combining okra with anti-diabetic drugs. If you're new to okra or concerned about its effects on your digestive system, moderation is key. Here are some science-based consumption guidelines. Raw okra. Start with 100 grams daily, which equals around 8 to 10 medium pods. This provides 33 kilocalories, 3 g of fiber, 7 g of carbs, rich amounts of vitamin C, vitamin K, folate, and magnesium. For gentler digestion, try okra-infused water. Soak 4 to 5 pods overnight and drink the water in the morning. This reduces fiber content but retains antioxidants and water-soluble vitamins. Beginner-friendly progression plan. Week 1, 2 to 3 pods every other day. Week 2, 2 to 3 pods daily. Week 3, 4 to 6 pods daily. Week 4 and beyond, up to 8 to 10 pods, 100 g daily. Follow manufacturer guidelines strictly. These forms are concentrated and may exert more pronounced effects, especially on blood sugar and digestion. Start with 1 to 2 pods daily and closely monitor blood glucose levels, particularly if you are on insulin or oral hypoglycemics, as okra has been shown in some studies to slow glucose absorption and improve insulin sensitivity. Even nutrient-dense superfoods like okra can cause unexpected side effects in certain people, especially when consumed in large amounts or without considering personal health conditions. Digestive responses are highly individual, so pay close attention to your body's signals. Always consult with a healthcare provider if you have digestive conditions, IBS, IBD, gastritis, ulcers, kidney disorders. Okra is high in oxalates. Diabetes, due to possible interactions with medications, or if you're planning to increase intake drastically or use supplements. Have you experienced bloating, gas, or digestive issues after eating okra? Or maybe it's helped soothe your gut. We'd love to hear your experiences in the comments below. If you found this information valuable, please give this video a like, subscribe to our channel, and hit the notification bell so you don't miss our health videos. Thank you for watching, and take care of your gut. It's the foundation of your health.